Thank you, Adrian. And I'd like to thank everyone for taking the time out of your day to join us. We will discuss magnesium, as you can see, and forms, functions, and clinical use. Hopefully, that summarizes everything that you're hoping to learn today. I will just cover the basics of magnesium and some important practical tips and information that you're going to need to navigate the supplement marketplace with regard to magnesium. So, I want this presentation to be informative and very practical for your purposes. First, I just want to disclose that I am a paid employee of Pure Encapsulations. I have no other conflicts of interest. My opinions don't necessarily reflect those of the company. Learning objectives are presented here. We're going to focus on the different forms of magnesium because this is where a lot of practitioners aren't sure how to make a confident decision. We're also going to talk about best practices when assessing magnesium status and some things that you should know about the different methods that are out there and their strengths and weaknesses. We'll also go over some up-to-date information on evidence-based use, dosage, duration, and monitoring, and look at cognitive, mental health, cardiovascular health as some key indications for this mineral. And then finally, we'll review contraindications and drug interactions that you should be aware of. We'll get to questions at the end. Magnesium is one of the most abundant minerals in the body. It plays many important nutritional roles, including neurotransmission, cardiovascular function. It plays a part in bone mineral density and muscle relaxation, just to name a few. Surveys in the United States show that the groups with lowest magnesium intakes are the elderly, especially men over the age of 70, and adolescents who actually need a little bit more magnesium than young adults do. You can see the recommended daily allowances on the right. In a table, you can see that the recommendations are generally between 310 and 420 milligrams per day. The National Health and Nutrition Survey in the US finds that 48% of American adults consume less than the estimated average requirement of 255 to 350 milligrams of magnesium per day. And the EAR is the value that is considered to be sufficient for about half of the population. So it's definitely a lowball estimate of the amount that we really need. But this goes to show that most people aren't really hitting the mark as far as getting the adequate amount of magnesium that is recommended based on studies. So today I'm going to talk about different ways to bridge that gap. You could bridge the gap with foods. You could use supplements. You could use both. We're also going to be talking about bioavailability and how that plays a part in repleting and maintaining optimal magnesium status. The two areas of clinical relevance that we will go over today are cardiovascular health and cognitive and mental health. So if you deal with patients in the United States, chances are quite a few of your patients have one or both of these issues. So magnesium should be a foundational consideration when you're dealing with these specific conditions. So we're going to start with cardiovascular health and discuss where magnesium fits in maintaining cardiovascular health. So it's a big area. Most of you probably feel overwhelmed with cardiology. It's not something that many practitioners really spend a lot of time keeping their knowledge base up to date. But if you think about cardiovascular health in this way, it's easier to assimilate new information when it comes to supporting cardiovascular health. Of course, we have the heart and the blood vessels. And with the heart, the myocardium is the muscular part of the heart that actually contracts. And magnesium plays a part in maintaining the healthy rhythm of the electrical conduction system that drives those contractions, the strength of the contractions and the rhythm of those contractions. And that governs blood pressure. It governs a lot of other aspects of cardiovascular health, including blood clotting and maintaining good hemodynamics. And then we have the vasculature, which is where a lot of the problems are in America. So we have this tube that is the artery, and it has an outside and it has an inner lumen. And it's really the lining and the muscle layer where magnesium definitely plays a part in keeping blood vessels healthy and functioning properly. With the vascular smooth muscle, just like the heart muscle, magnesium plays a role in relaxation. So it helps to relax this muscle layer, which is critical to helping blood get through. And then the endothelium on the far right, this is the innermost part of the blood vessel or the artery. And this is where a lot of the stress happens when there's, elevated pressure. You can get some injury happening in the endothelium. As we age, our endothelium doesn't function as well. It doesn't make as much nitric oxide. but might be more susceptible to having prostaglandins that are a little bit out of whack. And magnesium plays a role in maintaining those particular homeostatic functions in the endothelium. So on a more mechanistic level, here we have the artery and the myocardium. And magnesium is a calcium channel blocker. It doesn't work quite as strongly as calcium channel blocking drugs. But when it's inside of the tissues, it acts on both sides of this calcium channel, which normally causes muscle contraction. And it helps to balance out the contractile inducing effects of calcium. It helps to relax these muscles, whether it's the artery or the myocardium. And then we have a nitric oxide mediated mechanism that magnesium plays a part in keeping nitric oxide levels within a healthy range of production. Nitric oxide directly dilates the blood vessel wall. So, critical aspect of cardiovascular health. It's hard to manipulate magnesium in clinical studies because there's so many variables, and we'll talk about some of those, but it's very easy to manipulate magnesium in an isolated experimental environment where you have an endothelium in cell culture, tissue culture. In these studies, if we have really low magnesium levels in the endothelium, there is an increased permeability of the endothelium. There's also a reduced bioavailability of nitric oxide, an increase in inflammatory cytokines. We have more leukocyte adhesion. And then when we replete magnesium, those processes reverse. So we get better nitric oxide presence. We have a downregulation of inflammatory mediators and cytokines, and as well as von Willebrand factor, which is a pro-clotting factor that's downregulated when magnesium levels are high. So the homeostatic functions of magnesium have been described in many expert reviews. This is a representative synopsis of the impact of magnesium on the endothelium itself. So cognitive and mental health is another reason why many people are interested in trying magnesium or optimizing their magnesium levels. That makes a lot of sense. There's ample clinical and epidemiological data that connects magnesium and mood and emotional wellness. So higher dietary magnesium intakes are associated with healthier responses to stress, positive mood, and emotional well-being. Some representative articles are cited at the bottom of your screen. So magnesium intake is critical for maintaining mental health. And one of the reasons for this is that magnesium plays a part in neurotransmission, which is the communication between neurons. And this type of communication that you're looking at here is an inhibitory type of communication where one neuron is telling the other neurons, just cool it, relax, stop firing so much. So gamma aminobutyric acid, this is an inhibitory neurotransmitter that magnesium supports. And it binds to the GABA receptor. And when that happens, there's a chloride influx that causes inhibitory neurotransmissions. This is really important when it comes to feeling more relaxed in the presence of a stressful stimulus. It might play a part in sleep. There are some studies on magnesium and sleep. So that's one of the ways in which magnesium is supportive. On the other hand, we have excitatory neurotransmitters like glutamate that activate these calcium channels. And when calcium goes into a neuron, causes depolarization and firing of the next neuron. So that's a stimulatory event. And the NMDA receptor is a type of glutamate receptor. Magnesium directly binds inside of this channel and reduces the influx of that stimulating calcium. So magnesium plays a negative regulatory role. It helps to turn down some of this glutamate signaling. And in psychiatry, there's a lot of interest around glutamate and helping to relax the mind. And there's a lot of opportunity there for agents that modulate NMDA receptors. So there's a big area of research in both pharmaceuticals and nutraceuticals. But magnesium, we know, as a nutrient, when it's in sufficient supply, does bind to these channels. So when you have magnesium in your bloodstream, it needs to go into your central nervous system in order to do anything in the brain. So the blood-brain barrier is this phrase that you hear a lot, but I don't think many speakers really show what it looks like. So I've created this illustration here to show you what it really means. So we have a blood vessel, a cross section of a capillary that's in your head. There are lots of them. And then we have this layer of astrocyte processes, these feet of neurons, or if you will, these are astrocytes that are in purple. And what this picture pretty much summarizes is there are a lot of membrane barriers that something has to get across in order to reach the brain. And magnesium in the bloodstream might be charged, it might be too polar, it might not be able to cross this membrane, this lipid membrane barrier quite so well. We know that it does, but there are ways that you can enhance that brain entry. One way you can do it is binding the magnesium to threonate, and threonate is an amino acid that allows better entry into the brain through these membranes. So there's a lot of good research out of MIT on magnesium L-threonate or MAGT and its ability to get into the mammalian brain when given orally. Not only that, but this has been studied in humans, and this human study found that there was an improvement in executive function after 12 weeks of supplementation with MAGT. There was also an improvement in overall cognitive ability. So these individuals took magnesium L-threonate over the 12-week period, and significant cognitive benefits were evident compared to baseline. If you want more information on that study, I'd be more than happy to send you the full text article. Let's talk about optimizing magnesium status. And there are a number of ways you could do this. I always like to start with food. For dietitians in the audience, I know that you feel the same way. I have here the top 10 sources of magnesium. So this is really handy to just give to patients. You can go to myfooddata.com. It's a really great website to just get this top 10 list and show it to your patients so that at least they have something to look at, that these foods are really rich in magnesium. So spinach, definitely one of the best sources, as well as nuts, legumes. So this is a very handy resource. We know that magnesium bioavailability isn't all that great. So one of the reasons for this is that the body likes to regulate the amount in the blood, and it likes to get rid of every single ounce of extra magnesium it possibly can after you ingest it. So when you ingest dietary magnesium, whether it's from food or a supplement, you're going to absorb anywhere from 30 to 70% of it through the small intestine. And then it's going to go into the bloodstream. And when it's in the blood, it wants to go into tissues quickly. And it really mostly goes into your bones. And the bones hold 50 to 60% of the body's magnesium, and muscle holds the second highest amount. And the rest goes right to the kidney. It gets excreted. So if you measure urinary magnesium, that's a really good indicator of how much magnesium is being consumed, simply because it's proportional to the amount that's being consumed. The more magnesium you take in, the higher the urinary output is going to be. So this is why we need a continuous supply of this mineral. We can't just have a bolus dose every other day. We really need to get it daily, preferably in every meal. So in reasonable doses throughout the day. So let's just talk about supplements, just an introductory, practical way. And I've been working in the supplement industry for my entire career. And one of the most confusing areas is this thing called elemental weights. And they're different forms of minerals take up more or less space in a pill. And there are pros and cons to each one. With magnesium on the left, we have 5 different forms that you probably recognize: magnesium oxide, magnesium sulfate, citrate, malate, and threonate. Magnesium oxide is attractive because it's got very high elemental weight. You could cram a lot of magnesium into a pretty small pill. And it's also really cheap. So patients love that. You can get 400 milligrams of magnesium per pill at a really economical price. You get a huge bottle of it that lasts you forever. Problem is the bioavailability is extremely low. So you're really not absorbing much of it at all. Same with sulfate. Mag sulfate is given intravenously for select medical conditions, but it's also available as an oral supplement. Again, very poor bioavailability, high elemental weight, low cost. With magnesium citrate, we get into this is an organic compound, so it's bigger, it has carbon in it. You can see it's a bigger molecule. This is much more bioavailable because it is an organic molecule and it's not really as much of a salt. So it's not going to want to dissociate so much and become separate, which that's what causes problems. We'll talk about that in a minute. Magnesium citrate, malate, threonate are all organic forms of magnesium. They're more bioavailable than oxide and sulfate. So that's the key takeaway. The forms that are bound to an organic molecule tend to be better absorbed, more bioavailable. And this includes magnesium glycinate or magnesium bisglycinate. That's a true chelate. You can see in the dotted circle, it's part of a ring system. And that's the rigorous chemical definition of a chelate. Chelate is when it's embedded in a ring system where it really can't dissociate. It's stabilized that way. So why does that matter? If you look on this is obviously a stomach, and if you see the magnesium oxide molecule on the upper part of your slide, what happens is the oxide gets dissociated. You end up with magnesium as a charged ion in the stomach. And when it's charged, it's going to want to bind to something, and it's going to want to bind to whatever food or whatever matrix it can find. It might bind water, or it might bind fatty acids to form soaps, which are not absorbable. Could bind cellulose to form an insoluble complex. Could bind phytate, which if you consume it with vegetables or fibers. So this can really diminish the bioavailability of magnesium if you use oxide. Whereas if you use magnesium glycinate, that ring system protects it from dissociation and interference with the matrix of the food that you ate. So it's going to be more apt to travel caudally down the intestine and get absorbed where it should without getting complexed with something that's going to limit its uptake. So that's the key difference between the magnesium salts and the magnesium chelates. And this really applies to pretty much every other type of mineral. So always look for an organic form of a mineral. So what happens when it gets into the small intestine? At least the stomach goes into the small intestine, and it gets absorbed through two major routes. The first is on the left, and the first is magnesium goes through this channel. This is a channel that is reminiscent of the vanilloid receptors. It's TRPM6. And that channel allows this charged compound to get across a lipophilic membrane into the cell. And that's one of the main reasons, one of the main ways that magnesium gets absorbed. Magnesium can also, in number two, can travel between cells, and that's called the paracellular route. So that's actually a very significant avenue for absorption of magnesium, just getting between these tight junctions and sneaking in between the gut cells, getting in that way. You can use sucrosomials, which are like liposomes, and they can actually cross the membrane without any carrier, no channel through the cells. It depends on the type of magnesium that you're using, but for the most part, these are the ways that magnesium, whether it's from food or a supplement, is going to be absorbed. So that's shown here as a liposome, and a sucrosomial magnesium is a liposomal form that sort of just travels through the cells and delivers magnesium that way. It's going to be more expensive, but bioavailability is going to be pretty good because you're getting through that lipid bilayer. So we talked about foods that are rich in magnesium. We talked about the absorption and what happens to magnesium after you ingest it. But the factors that determine someone's magnesium status are quite diverse. So I want to mention 4 of the major factors that determines your magnesium status so that you could best optimize this from all angles. So first we'll talk about diet and lifestyle. We'll also talk about age, health, and medications. So we'll start with one of the key lifestyle factors that we're all familiar with, and that's stress. It turns out that stress has a profound impact on magnesium status in a variety of different clinical models of different types of stress. So here's a summary of some of the studies that show that to introduce a healthy population to different stressors, you can see that there's a negative impact on magnesium, whether it's plasma magnesium or red blood cell magnesium or urinary output of the mineral. So some of these have been done with university students who are a nice, convenient specimen for stress. So this actually is a vicious circle. And you might be exposed to, we all are exposed to stress. It's mainly the chronic stress that does this, reduces magnesium status. And recall that magnesium plays a part in helping our brains relax, helping our central nervous system turn down some of that excitatory signaling. So then we have an increased susceptibility to the effects of stress when that happens. This is a vicious cycle that was first proposed in the early 90s, and it has held up very well over the years with supporting data. So it remains supported that You want to optimize magnesium, particularly if you are under stress. And it's not surprising that if you give magnesium as a supplement, there's a favorable effect on different stress related parameters. So we have different types of occasional stress, whether it's university exams, endurance training, or musculoskeletal pain. We have different doses of magnesium supplements working pretty well in providing a clinically significant outcome with regard to whatever stressor that was. So this is actually taken from a really nice review that was published in 2020. The references at the bottom of your screen. But hopefully this kind of gives you a reason to consider magnesium if you have patients who are dealing with stress. So that's the key lifestyle factor that you have to keep in mind. Now let's just we want to talk about diet. And we already went over some of the top foods that provide magnesium, but we also have to recognize that there are compounds in foods that can reduce magnesium bioavailability, and there are some compounds that enhance it. An easy way to enhance the absorption is to consume fermentable carbohydrates, also known as prebiotics. These include fructooligosaccharides, galactooligosaccharides, and inulin. And in several clinical studies, this increases magnesium absorption, probably through shifting the microbiota or changing the pH of the intestine. On the other hand, the non-fermentable insoluble fibers, which we also need for good health, happen to decrease magnesium uptake in the gut through directly binding to the mineral and forming an insoluble complex or a chelate. So bran cellulose, high amounts of those will reduce magnesium uptake. Some of the other antagonists in foods are oxalate, which is found in spinach and cruciferous vegetables, and phytate, which is found in whole grains, both of which decrease magnesium uptake by directly binding the mineral, forming a chelate that does not get absorbed. So you might want to separate the timing of dosing. If you have someone really want to push the magnesium up to the most optimal level as quickly as possible, you don't want to take it with a really high fiber meal or with a huge plate of spinach or whole grains. You might compromise the bioavailability. Let's talk about health conditions. Several health conditions can reduce magnesium status. Gastrointestinal conditions that involve malabsorption are definitely one of the top health conditions that can reduce levels in the blood and levels in tissues. Anyone with gastrointestinal conditions, mainly inflammatory bowel disease, you want to look at magnesium intake through food. If you can, get a magnesium level in their red blood cell. Just show you some ways that you can measure magnesium in the body. You really want to focus on looking at how much they're taking in, how much they have in their body. And then alcohol use, for a variety of reasons, will reduce magnesium levels. Renal disease as well. Anyone with chronic kidney disease, you want to watch their magnesium. And then any condition that causes excessive urination or polyuria, including uncontrolled diabetes. Whenever you have increased urinary output, this includes the use of diuretics, you will increase the output of magnesium. So that's a rule. So always keep that in mind. As I mentioned in the beginning, the elderly are among the lowest consumers of dietary magnesium in the US. There are a variety of reasons why they tend to have lower magnesium status. In addition to not consuming as many magnesium-rich foods, they also have a reduction in stomach acid that occurs naturally with age. And an acidic environment in the upper GI tract is really important for keeping magnesium in the proper chemical state that needs to be for absorption. The elderly also have reduced intestinal absorption of magnesium and some other minerals. They also tend to excrete more through their kidneys. They're more likely to be on diuretic medications as well. So these are just a few of the reasons why you want to watch magnesium closely in the elderly. The use of certain medications can reduce the amount of magnesium that's in the blood. And these are shown here. I mean, basically diuretics, diets. Hydrochlorothiazide is the prototype in this class, which will reduce magnesium levels by enhancing its output through the urine. So how do you manage this? You always want to look with diuretics. You want to make sure you look at the package insert for the particular drug product that you're dealing with. That way you can see specific contraindications for magnesium. You might not want to use high dose magnesium for whatever reason. Let's say someone has chronic kidney disease. That's where you would want to go first. Go to the PDR or the package insert to get any instructions on if you need to be careful in certain patient groups. One type of medication that most of us are familiar with is the proton pump inhibitor class. This class includes omeprazole, so Nexium, Prilosec, commonly used for GERD and gastroesophageal diseases. These greatly diminish the acidity of the stomach, and in doing so, they reduce the absorption of magnesium. You always want to consider magnesium supplementation, especially with long-term use of these drugs. The proton pump inhibitors are probably the most offensive of the acid reducing medications out there because they are so effective at really knocking down stomach acid. They're extremely effective. They're much more effective than the H2 receptor antagonists. You really want to look at those as some of the top offenders. The H2 receptor antagonists are a little bit milder. They don't have this long acting pharmacokinetic profile like proton pump inhibitors. Some of them have a 24-hour duration of action. So you really can't separate the dosing. Whereas cimetidine, famotidine, like Tagamet, ranitidine, you can separate the dosing by several hours to avoid the interaction. Antacids are very easy to work with. You simply separate by 2 hours. This is all in the physician's test reference. It's also written in the package insert for these medications. So you have those resources, but this is a nice summary. There are a couple of drug interactions that you should know about. These are really the only drug interactions that you probably should just try to commit to memory. Tetracyclines and bisphosphonates. So the tetracyclines include doxycycline, which is used for Lyme disease, and tetracycline, which is a very old and commonly used antibiotic. And magnesium will reduce the gastrointestinal absorption of these drugs. So you want to administer magnesium at least 3 hours before or 3 hours after giving oral tetracyclines. And that's from the PDR. Bisphosphonates, these are used for osteoporosis and other bone conditions. Again, taking magnesium will reduce the oral absorption of these drugs. If you're giving them parenterally, that's not an issue, but orally, yes, it is a problem. So you want to separate by at least 30 minutes. If you're interested in learning more about drug nutrient interactions, Pure Encapsulations has just launched a drug nutrient interaction checker that I helped to create. And this is different from other checkers out there because it focuses on clinically relevant interactions and it doesn't inundate you with all kinds of theoretical noise. We focus on interactions that can really happen in your patient in real life. They can occur at typical doses and they have a meaningful effect on the body that you should know about. And you'll find very specific instructions. Should you separate the dose? Should you reduce the dose? Should you avoid it altogether? Many checkers don't really provide that level of instruction. So this really takes a very difficult and confusing conversation. It makes it extremely simple. Also helps you educate your patients because there's a patient-friendly version as well. So let's talk about magnesium assessment. And this is where a lot of progress still needs to be made. Let's talk first about the easiest way to look at magnesium. That's just looking at magnesium in the blood. So when magnesium levels in the blood are low, it's called hypomagnesemia. Difficult word to say. This is an electrolyte imbalance because magnesium is an electrolyte and it requires a medical intervention. It's not necessarily indicative of just a nutritional deficiency. There could be some other imbalance that you need to attend to. It's pretty uncommon based on prevalence data that's been published, but it's probably underestimated because electrolyte testing isn't always done in hospitals, not at least widely. So many people could be walking around with low magnesium and they just don't know it. But the estimated prevalence in the general population is anywhere between 2.5 and 15%. So the clinical signs and symptoms of low blood magnesium, which is defined as less than 1.8 milligrams per deciliter, include neuromuscular symptoms like weakness, tremor, tetany, just muscle stiffness, and cardiac symptoms, which will be evident on an EKG, a long QT interval, a wide QRS interval, or other arrhythmias. Calcium is often disrupted in these individuals. Low calcium is not uncommon. Low vitamin D activation, problems with vitamin D metabolism might also be observed. and low parathyroid hormone levels might also be evident. And similarly, potassium might also be a little bit out of whack. Hypokalemia is common in people with low magnesium. So it's really a symptom of something else, some kind of situation that requires medical attention. But it doesn't mean that this is not a reason to consider supplementation once you have crossed all the boxes as far as assessing for more serious issues. This is where some of the more specific tests come into handy. And we really want to look at the magnesium that's inside of cells. The best way to do that is looking at the red blood cell because it's just a very accessible type of cell blood sample. So here are three tests that are really great options as far as looking at red blood cell magnesium levels: NutriVal, Micronutrients Panel for Vibrant America, and the Access Medical Laboratories Magnesium RBC. And these are all available through Rupa Health, and there are more in-depth descriptions of each of these on the Rupa Health website. These are all excellent vendors. They're excellent tests. So the RBC magnesium currently is probably the best test that you could run. A serum magnesium is never a bad idea. You want to know if there's low serum magnesium. Dietary intake is really a hassle. It's difficult to get people to keep a food diary and get that data. But if you can collaborate with a dietitian or find an easy way to just at least get a sense of general magnesium intake, that could be extremely helpful. In fact, most of the data on magnesium intake in the US is just based on dietary intake because lab data and just aren't that those types of data are not available on a large scale. So keep in mind, you want to shoot for anywhere from 310 to 420 milligrams per day, depending on age and gender. So dietary intake is something you really should look at. Urinary magnesium, as I mentioned, is proportional to magnesium intake, much more cumbersome to collect, but it is available, I think, out there, mostly in the research settings. And then ionized magnesium and the magnesium loading or tolerance test really used more commonly in academia and publications that we might look at on magnesium, not so much commercial go-to tests. But the future probably will bring some other options as far as really getting a clear idea of where someone stands in terms of their overall magnesium status. Probably the easiest solution for now is just make sure you hit that mark, get the RDA. Going over it a little bit, that's perfectly fine too. So let's talk about choosing a supplement. So I'm not going to go too quickly here because this is a lot of information. This is probably, hopefully, a very useful and practical information. As we talked about at the beginning, magnesium oxide is obviously very, very advantageous in the sense you get a lot in one pill. It's very cheap, but it's very poorly absorbed. The tolerability, because it's a mild laxative, is fair. Many people can't tolerate it, doses that you would want to use. The trait is better tolerated, it's better absorbed, only slightly more expensive. This is great for just general purpose use. It can be a laxative at the higher doses. So it is classified as a laxative in the Merck Index and in some of the pharmacology textbooks. But you really need to take quite a few pills for the most part to get that effect. And everybody's different. So it's best to start with a low dose of 150 milligrams. That would typically be one capsule and just see how that goes. So most people tolerate it quite well. Citrate malate, very similar to citrate. Again, it's definitely cost effective, good tolerability, great for general purpose. We don't really know how it differs in bioavailability compared to these other forms, but it is an organic chelate that will definitely exceed the pharmacokinetic performance of the magnesium salts. Magnesium glycinate is probably the best form in terms of overall absorption and the pretty much the absence of a laxative effect, at least at the doses that are commonly used. So great for people with sensitive guts, sensitive stomachs, extremely well tolerated. Typically, you'll get 120 milligrams in a standard capsule, and that's pretty good. Just take maybe 3 capsules a day to bridge the gap, include dietary magnesium, and you're all set. The magnesium threonate, or the MAGTEAM, we discussed as perfect for someone looking to support their cognitive function and their executive functioning skills. That has the lowest elemental weight. So I would not recommend using the threonate as your sole source of magnesium, only because you're only going to get 36 milligrams or something like that in a standard large capsule. Tolerability, though, is excellent. And it's really great for getting into the brain barrier, delivering that cognitive support. We can come back to this table in the Q&A if there are questions around any of this information. So the take-home points here are pretty simple. Always assume that a good fraction of your patient base is going to fall short of magnesium. Just looking at the general statistics of Americans, aim for 320 to 400 milligrams per day. You can go over that. Just be aware. It depends on the form of magnesium you're using, and you could get some, mild laxative effect at higher doses. Consider red blood cell magnesium as your go-to for testing. You can also look at dietary intake. Serum magnesium is not worthless. That's worth running if you can. Proton pump inhibitors and diuretics may increase magnesium needs because they either reduce the absorption with proton pump inhibitors or they accelerate the excretion of the mineral, which is the case with diuretics. Proton pump inhibitors and diuretics are among the most commonly used medications in the US, especially among the elderly. Always choose organic chelates over magnesium salts. So the chelates, magnesium glycinate, magnesium citrate, citrate malate, threonate. So the salts would be magnesium oxide, magnesium sulfates, and magnesium gluconate is also considered to be a salt as well. So the salts, they like to dissociate, they bind to random things. They're just less well absorbed than the more intact chelates, which protect magnesium from the elements. So Pure Encapsulations offers a variety of magnesium formulas that are listed on the right-hand side of your screen. These products, as with all Pure Encapsulations offerings, are free from unnecessary additives and many common allergens. If you don't already have an account with Pure, you can easily register for an account by scanning this QR code, or you can just visit pureencapsulationspro.com. I will be more than happy to bring this up again in the Q&A. Before we get to the Q&A, I just want to offer this coupon code. For those who are listening in and you don't see the slide, you can just write down this code. It's KH1123W. And that's going to get you a $25 credit and free shipping on your next order with Pure Encapsulations. And this is for direct orders by healthcare practitioners only, and it's valid only in the US. So I will leave that up for a little bit. First, I want to thank you for your attention. I know we went through a lot. I do look forward to your questions.
Hi, everyone. We hope you enjoyed this class. If you're a practitioner, make sure you go sign up at rupahealth.com. And if you like this video, don't forget to like and subscribe.